Hello, 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 world. This is Louise Hicks, your host of Aim to Purpose Spiritual Empowerment Hour. And I have a special guest today, and we're going to talk about Black women's health. So let me give you a little preview, and then I'm going to introduce our guest. So bear with me. Here we go. Just a little preview of what's going on. And we want you to be sure and share this video because it's important information that we're providing here to help us navigate through the medical system.
This is Jessica Petway. Jessica is a popular YouTube personality. Over the last decade, she's grown an adoring audience that followed her tutorials catering to natural hair, makeup, and fashion. In mid-July of last year, Jessica took to social media to share something different with her followers, something personal.
Okay, we're going to share Jessica's personal story. So let me stop sharing and get back to my guest, Lily Bell, and she's going to introduce herself. And again, I am Louise Hicks, your host. Please share this video and thank you all for coming to my channel, sharing in with it, sharing with your loved ones, your friends, because I'm here to impart information that is vital to our Black community and anyone else that wants to empower themselves and enhance this society, not only in America, but across the world. So, hi, Lily Bell. How are you? And welcome to the show. Please give us a brief introduction of yourself. And I know you have your own podcast. So, share a little bit of that with us.
Hi, excuse me. Hi, Louise and audience. As Louise said, I'm Lily Bear. I talk about what you're afraid to even think about. Our podcast is called Lily Bell underscore Beneath the Crust 2023. And as with Louise, my goal is to raise awareness to get us to think. I don't ever tell you what to think, but I do tell you to think. It's critical, but it's always been critical. But now, as that old saying, these are the times that try men's souls. Our souls are being tried right now. So this is the time for us to start thinking, to start looking, not be so emotional and act through emotion. It's time for us to put our thinking caps on and to think. So I hope you get something from what I know you'll get something from what we're saying. We trust that you will be enlightened, encouraged, and intrigued. I'm Lily Bell.
And as you heard Lily Bell says, she said that with force. I am Lily Bell. And again, I am Louise Hicks of this podcast, Aim to Purpose Spiritual Empowerment Hour, where my goal is to uplift and raise our people to a higher level of consciousness. So please like, please share, give it a thumbs up, leave your comments because we are about to share with you how we as Black women need to be more conscientious about our health care because the medical system, the mental health part, as well as the medical part of it, is broken. It's a broken system. So we have to be advocates for ourselves and we have to be advocates for others that look like us because this system is not built for us. That's why it's so important that we take control of our own health. And I'm about to share a story of a young YouTuber. I gave you an introduction of it. Please continue to watch the rest of this story because we have two Black female doctors that are going to come on and they're going to share some information with you that is vital, very, very vital for us as Black women as we navigate ourselves through the healthcare system so that we can have better health because otherwise you're going to get substandard care. And I can tell you, I've been there in this system and I know what I'm talking about. So let's go ahead now and share the video. And Lily Bell, be sure and stop me when there's a point that you want to make. Stop and let's talk about it because that's how we inform one another. So let's go ahead and listen to this woman's story.
Wasn't about beauty, but about health. She wrote, in part, on July 1st, 2022, at 4 a.m., my husband found me in the bathroom, unresponsive and not breathing. I was rushed to the hospital where they told me that the extreme blood loss was due to fibroids. My gyno made it seem like it was so normal and common. I didn't think much of it. However, I was passing clots the size of a placenta, which was really alarming. They kept me overnight and released me the next day. Fast forward to July 22nd, I was hospitalized again for the same thing. Again, the medical professionals treated it like it was not that alarming since it was just a fibroid. Jessica goes on to explain that the bleeding eventually stopped, but labor-like pains replaced it. She said her life became limited, but the doctors continued to brush it off as fibroids. After more hospital visits and temporary fixes, Jessica saw a female doctor who took her seriously. After undergoing a biopsy, she woke up from anesthesia to the news that she had stage 3 cervical cancer. She had been misdiagnosed the entire time. On March 11th, 8 months after she first sought medical help, Jessica Petway died. She was 36 years old. Jessica's story is not an anomaly. It's statistically proven that women, especially Black women, are often dismissed by medical professionals when expressing signs of pain and discomfort. According to a study,
let's stop here for a minute, Louise.
Okay, let's stop. Okay, we're going to stop and let's share some of our information. Go ahead, Lily Bell.
Well, the first thing I wanted to say is, well, as condolences to her family. I know it's been a minute, but still condolences to her family. But ladies, let's start being aware of our bodies. And she went to the doctor. They said it was normal. But if you're passing blood, even if it's a trickle and it's not your monthly cycle, then there's something to be concerned about. So let's start being aware of that. And for her, she said placenta. You know how big a placenta is? For those of you who haven't had a baby, you know, this placenta is what's attached to the baby. And if you're passing blood clots like that, there's definitely something that's wrong. And a lot of times, you know, these doctors have this God-like complex. They don't want you to question them. But this is your body. This is your health. Raise questions. Go to a different doctor. Do whatever you have to do. But let's become more aware of what's normal and what's not normal. I yield.
Yes, I agree wholeheartedly because oftentimes when we go to the doctor, they will dismiss us. I have personal experiences where I have gone to the doctor and I have been dismissed. I know of a personal story of a young Black woman who was a year older than Jessica, 37, I believe, went to the doctor. They told her that she had gas, dismissed her. And a few days later, she didn't get any better because they gave her medicine for gas. And she went back to the hospital, a different hospital. Within hours, she died. Her diagnosis was blood clots. So we really have to pay attention to what's going on in our bodies because you can lose your life because doctors will dismiss. Just recently, with my own son, and many of you who have seen this show, you know that my son at 14 was diagnosed with a rare bone cancer. He just recently lost his leg because of inadequate medical care. So it's up to us, particularly as Black men, women, children, we have to pay attention to our health. And this story I'll just have to share because we're going to have a couple of Black female medical doctors who are going to come in and give some more information on why it's so important for us to be our best advocate, as well as taking someone with you and write your questions down. That's so important so you don't forget to ask.
Yes.
And if that doctor dismisses you, don't hesitate to go to another doctor. Seek out a second opinion, third opinion. Don't just take one doctor's, particularly when you know your body. Just keep in touch with your body. Anything else you'd like to add before we get back to the video, Lily Bell?
Well, yeah, I can share a personal experience. I went to this doctor. My doctor, a black female, she retired and stuff. So I ended up going, in the same practice. I stayed in the same practice, but it was a different doctor. She was this foreign woman. She came in, and I started telling her what was going on with me, and she actually told me that that wasn't happening. That's not happening. I said, "Excuse me." And those of you who know me, you know that didn't go too well. But anyway, but everybody's not as vocal as I am. Everybody's not doesn't have this strong personality as I have. But when it comes to your health, you have to develop that advocacy spirit and stuff. And I had that's it. Speak up, speak up.
That's
And
right.
and she gonna end up telling me that I was telling her what was going on. She's gonna tell me what's not happening. But and I get if we have time, because I don't want to spend too much time on me. I want to get to the other stuff and all that we're going to be talking about. But I'll be sharing more about that. But I just want to say, echo what you're saying, Louise. You, excuse me, you got to speak up. And I know a lot of times we're intimidated about doctors and stuff because they're supposed to be the people who, if I'm going to you, I expect you to tell me what's best for me. But that doesn't always work. I yield.
No, it doesn't. And that's why I always stress, speak up, speak out. And I always share with you on my podcast, 2 Timothy 1:7. For God has not given us the spirit of
Spirit of
fear,
fear.
but a power, love, and a sound mind. God has given us that sound mind. Use it to your benefit because some of these doctors will dismiss you because we know we live in a racist society and you never know who you are seeing, who that doctor is, unless you have taken the time to do your due diligence. Research your doctor before you choose a primary doctor. That's what I did. It took me over a year when I moved to Texas to find a primary doctor, and I found a good one. And I'm happy to say my doctor never tries to push anything on me. She asks me questions, and if I ask her questions, she gives me answers, and I let her know what I will and what I will not do, what I will take, what I will not take, because I do my own due diligence when I'm giving a prescription. And Lily Bell and I are baby boomers, by the way. And I know a lot of the younger generation, the millennials, the Gen Xers, the Zs, a lot of them and alphas are coming up. A lot of them think that just because we are older, we don't have understanding, but we have a lot of understanding. We have wisdom. Those of us who do our due diligence, and believe me, Lily Bell, she just doesn't go beneath the crust. She goes all the way under. She will go through the crust or whatever she has to do. She's very outspoken, and that's why I admire her and I have her on my show quite frequently. And because she has a lot of wisdom, and that's important. And a lot of you young people that are out here, particularly our Black ones, take control of your life in a positive way. All this food talk, as my grandmother calls it, so you can make a buck. Some of you would throw your mother under the bus in order to make
Yeah.
a buck. And that's not healthy. And we have to really hone in on those. So let's get back to this video so that we can hear what these doctors have to say about what happened and why it's so important for us as Black women, particularly. That goes for the entire Black community. Pay attention to your health so that by the time you get to be my age, which is 74, you may not need any medication. I'm not on any medication. Let's stop making Big Pharma wealthy. So here we go. Let's get back to it. Give me a minute here. I'm going to get, there we go. Here's some more.
Reviewed medical journal owned by British Medical Association. American women and racial and ethnic minorities are 20 to 30% more likely than white men are to experience a misdiagnosis. These statistics and the all too common stories like Jessica's are proof of the importance of a diverse medical field, having doctors of different races and
I just want to stop real quick and make this point, and then I'm going to get right back to it. A lot of you may not be aware, but go and do some research about this, because let me share with you when he mentioned about the percentages. At one time, and even maybe now is happening, it could be happening, I know, in some parts of this country as well as others. A lot feel like what Lily Bell said she went through. We don't feel pain as Black women. Do you know they did experiments on Black people? Any of you look up the Henrietta Leaks story? Read the book. We got to read more. We got to share more. They felt as Black people, we didn't have pain. They felt we had a disease because Black people were running away from slavery. So we got to watch out for these white supremacists who think only of themselves. They don't care about you. We have to care about ourselves and one another. So I just wanted to put that in there, because they say here, do no harm. And you definitely do not want anything to harm you. Stay alert. Anything you want to say to that before I get back to the video, Lily Bell?
Well, I just want to urge our young people to consider going into the medical field. Finding Black people in the medical field is almost becoming like they say, a dying art. And one of the reasons, because they make it more difficult now, and plus with the medical insurance and everything, it's a real task, I guess I would say. But if you're so inclined, consider going into the medical field. And what I'm going to suggest to me, Louise, and those of us boomers and silencers and everything, let's start creating an environment where these young people will want to go into these fields. Create environments where we can find some way maybe to undergird them. I yield.
Great. Let's get back to the video.
ethnic backgrounds and doctors who are trained to consider diversity and racial disparities is literally of life and death importance. So you would think that lawmakers would want to shore up that life-saving diversity factor in the medical field. But you would be wrong. On March 19th, 8 days after Jessica Petway's passing, the Republican Congressman Greg Murphy of North Carolina introduced a bill to put an end to diversity, equity, and inclusion in medical schools. Murphy's bill, called the Embracing Anti-Discrimination, Unbiased Curricula, and Advancing Truth in Education Act, aims to ban race-based mandates at medical schools and accrediting organizations. When introducing the bill earlier this month, Congressman Murphy, who's a doctor himself, said that if he were to apply to medical school today, his odds of getting in would be greatly diminished because of his race, gender, and religion. He went on to say, quote, prescription pads and scalpels are now being weaponized.
Really quickly, we'll get back to that. That's a lie.
Oh, I was getting ready to say it. Go ahead.
If you do your research on DEI, you will find out DEI benefited white women, white men, other ethnic minorities. Black people were the last ones to benefit from DEI. So that's a blatant lie. So we really have to do our research, and we have to stop these lies, because they want you to believe these lies so you can stay on these medications. You can believe everything a doctor tells you, and you don't go and do your own research before you take some of these pharmaceutical medicines that are detrimental to your health. So that's a blatant lie. Go ahead, Lily Bell.
No, I was just going to say just what you said.
Okay, let's go ahead and listen to this.
In some places, students across this nation are forced to sign a DEI fealty pledge, reminiscent of those days in the 1930s Germany and as well as Russia. What would Martin Luther King say today? In his great quote, I have a dream that one day my 4 little children will not be judged by the color of their skin, but by the content of that character. That content is what we call merit. What has happened to that dream?
And merit. That is interesting. They talk about merit. Black people wouldn't be getting into medical school if they weren't qualified. As I mentioned, affirmative action, DEI, who benefited most from affirmative action? White women. So when the program went away, it didn't impact us
Not at all.
because no, it did not impact us. DEI is not impacting us. So let's continue.
I want to say something here.
Oh, go ahead.
When they said, what would Martin Luther King say? First of all, he disrespected Martin Luther King as Reverend Dr. Martin Luther King. But the point I want to make to anybody, especially you young people, don't get caught up in that. See, what they do is they will take somebody they know we admire, what Dr. Martin Luther King said. They never tell you about what Dr. King, you know something Dr. King said, two things that I'm going to give. One thing Dr. King said the number one problem in America is white racism. Dr. King said
Absolutely.
perhaps a study needs to be done on white men to see what's wrong with them. And another thing Dr. King said, he said Black people need to be in control of their own resources, especially in their community. And I'm saying that to make the point of young people and anybody who's listening. Don't let them use Dr. King as a weapon against us. Let's study Dr. King for ourselves. I yield.
Absolutely, because that's exactly what this white supremacist, racist society, and no matter what anybody says, this America is a racist society. Racism has been here since its inception. And even some white people are starting to recognize and see why this country is so divided. And like I said, the medical industry is so corrupt that many doctors are quitting, nurses are quitting the field because it's money driven. It is not life driven, it's money driven. And that's why it's so important. And that's why I wanted to do this video. And that's why I'm doing this video, because we have to pay attention to our health. These people don't care about you. We have to love ourselves, love one another, share information, stop the food talk, because we're in a crisis, a huge crisis here in America. America is a hot mess right now, and it's been a hot mess from its inception. And Black people have come to a higher level of consciousness. More and more of us are honing in on what's going on, all the distractions, the Willie Lynch syndrome, to keep us divided. However, that is changing, and it's changing for the good. And we do need our own resources. That's why it's so important to watch how you're spending your money. And when you go to the doctor, ask questions, like I said, and I'm going to repeat this because this is vital. Write your questions down so that you don't forget. And if you have a doctor that is not willing to answer your questions, want to brush you off, like what happened to the person I shared with you that was young, misdiagnosed, young Black woman, misdiagnosed with gas and had blood clots. They didn't care. They will dismiss you. I've been dismissed, but I knew what to do because I worked in the healthcare industry for 32 years in management, not direct healthcare. I was indirect. However, I worked very closely with doctors and nurses, and I know how the medical system is run, the mental health system. They are corrupt, they're flawed, and you bet your bottom dollar, you better start doing your due diligence and being an advocate. And I'm glad you said that about Dr. Martin Luther King, because these people will try to distract you with all of this nonsense that they come up with. Here's a state representative or a senator from North Carolina, a doctor himself. And what's that? The topic was do no harm. As a doctor, you're not supposed to do any harm. And we do need more Black doctors. And the doctors that you're gonna see upcoming, they're gonna talk about that. So let's move forward. Unless you have any other comments, Lily Bell.
No.
Okay, let's move forward.
In his argument against diversity, he managed to invoke the Holocaust, Joseph Stalin, and Martin Luther King. I've said this before on this show, but it bears repeating. The point of DEI initiatives is to encourage representation and participation of people of different genders, races, ethnicities, religions, ages, sexual orientations, disabilities, and classes. It does not mean that people who do not know how to fly planes should be hired as pilots, or that students who can't learn the periodic table should be getting admission to medical school. Diversity training and diversity in medical recruitment helps counter the well-documented biases that contribute to worse health outcomes for certain populations. The Association of American Medical Colleges disagrees with Congressman Murphy's bill and his narrative. In an op-ed published in the Wall Street Journal, the association wrote that Murphy is mischaracterizing how medical schools establish curricula and that DEI in no way replaces a strong focus on the latest science and evidence. The op-ed reads, quote, "We must work to train the next generation of scientifically and culturally intelligent physicians. Neglecting the critical role of DEI in medical education jeopardizes the quality of patient care and the future of a profession built on the foundations of serving all members of society." Joining me now to talk about the life-saving importance of diversity, equity, and inclusion in the medical fields are two very good friends of our show. Dr. Ebony Hilton, a critical care physician and anesthesiologist. She's also the medical director and co-founder of Good Stock Consulting, which empowers leaders in healthcare to create systemic changes with equitable impact in their communities. And Dr. Uche Blackstock is an emergency physician, founder and CEO of Advancing Health Equity, which also works with healthcare organizations to eradicate racial health inequalities. She's the author of the book Legacy: A Black Physician Reckons with Racism in Medicine. Friends, thanks for joining us for this important conversation. Dr. Blackstock, let me start with you. Let's imagine for a second that this bill that Greg Murphy from North Carolina is talking about gets passed on a federal level. It feels like it's going the opposite direction of what we think needs to happen. But what are the actual dangers of people calling out diversity efforts and targeting them?
Well, Ali, thank you so much for having me and Dr. Hilton on. This is such an important issue to talk about because we literally are already in a crisis with respect to Black health in this country. When you look at indicators of wellness, Black Americans, our life expectancy is decreasing. When you look at the Black maternal mortality rates, that also is increasing. So we need a healthcare workforce that can adequately care for the diverse patient population that we have in this country. What this legislation would do is we would head backwards and our health outcomes would worsen. It's as if they want to kill us. Seriously, the fact is that Black Americans, we are not, as it is, receiving the care that we deserve in this country. And the statistics themselves say that. We cannot live long, full lives in this country, and these policies are going to counteract that.
Dr. Hilton, the Association of American Medical Colleges, which I quoted in the introduction to this, published an article last year with a headline that poses the question, quote, "Do Black patients fare better with Black doctors?" stating research shows that racial concordance can improve communication, trust, and adherence to medical advice. Can you talk to me a bit about this?
Right. And it's not just the trust. What we know is that a rising tide lifts all boats, right? And if Black patients do better, then that means white patients do better too. In particular with Black patients, when we're talking about across the board, whether that's cardiovascular disease, whether that's infant mortality, we literally know that if you have a Black physician and you're a Black patient, your child is half as likely to die before their first birthday. That's what study shows. And in talking about Dr. Murphy, let's bring it back to him. You know, he's a urologist. And if we're talking about health outcomes and what it means on a scale, if you have a physician that is a Black person or even a woman, what we know is that DEI has improved the outcomes across medicine. And in fact, if you have a female surgeon, we have shown that you have a decrease in your complications, you have a decrease in your readmissions, you have a decrease in death. In fact, there was a study of 1.5 million patients that showed if you have a female surgeon, your mortality is nearly divided in half. And that is important to say, especially when we're talking about Jessica Pettyway. What you mentioned is that once she had a female doctor, her symptoms, her complaints were recognized. And this is what it comes down to when we're talking about the presence and the influence of minority physicians, whether that's gender, whether that's race, whether that's sexual orientation. because we've had to navigate the system and navigate the obstacles that are in place within the medical system, we understand those flaws, which means that we can better plug in that system to make it stronger. And we recognize your symptoms, we listen to you when you speak to us, and we engage ourselves in a way that we treat you like family that ends up keeping you alive. And we won't have the deaths of Jessica Pettaway at 36. We won't have the deaths of Chadwick Boseman at 43. We won't have the death of Dr. Martin Luther King Jr.'s youngest son, just passed away from prostate cancer, Dr. Morphy's wheelhouse, right? 62 years old. Why are Black men twice as likely to die from prostate cancer than if they were white, right? We have to start talking about these facts and address it with real change.
Dr. Blackstock, Don Lemon recently spoke to Elon Musk about comments that Elon Musk had made about DEI. I don't generally play a lot of Elon Musk stuff on this show, but this one's important to listen to.
What I was referring to there was that if we lower the standards for doctors, such so that they, if the test for a doctor is lowered, then the probability of them making a mistake and killing someone is obviously going to be higher.
Wait, say that again. I'm not sure I understand what you said. I want to make sure I understand what you're saying.
Yes, if the standards for passing medical exams and becoming a doctor, or especially something like a surgeon, if the standards are lowered, then the probability that the surgeon will make a mistake is higher. They're making mistakes in their exam. They may make mistakes with people, and that may result in people dying.
What evidence do you have, though, that they're lowering the standards? There is no evidence of that.
I believe there is.
I believe there is. So Elon Musk has a vibe, Dr. Blackstock, that we're lowering standards. I want to be very, very clear that neither of you two women suggest that standards should be lowered to do anything, from, as I said, from flying a plane to being a doctor to being a surgeon.
Absolutely not. And so Elon Musk is significantly disinformed or misinformed. What he should know, and we have actually data from this, is that when you have a holistic review of applicants to medical school, when you are considering everything, not just their academic work, the community service, the road traveled, you actually create a more competitive group. They actually have higher statistics. DEI practices do not lower, and we're not asking anyone to lower GPAs or lower MCAT acceptance scores, but we do know that when you holistically evaluate an applicant for a medical school and take into consideration all of those parts of who they are, that actually makes a better doctor. And that makes it so that we have doctors that can care for patients of all diverse backgrounds in an adequate and competent way. And to be honest, that is not happening right now. And that's why we're seeing some of the mortality rates, the levels of chronic disease that we're seeing in our communities, because we have physicians and health professionals who cannot adequately care for people who look like us. And that is unacceptable. So we're not changing any standards. We are actually improving standards, and the data shows that.
Dr. Hilton, and I know you're jumping on his kid to respond to what Elon Musk said there, but I want to add this to it. DEI is becoming this new boogeyman in more ways than one, even outside the realms of medicine. We heard the Baltimore mayor, Brandon Scott, being labeled as a DEI mayor. Talk to me about this whole concept. The argument for DEI is let's fix things and diversify properly. No one's asking for extra stuff. No one's asking for lower standards. Nobody wants a doctor with lower standards or a pilot with lower standards.
Right, and it's one of these things that's laughable, considering that Elon Musk was given everything by his father. We can start there, but the second point I would also like to say is you're dealing with two unicorns right now on this screen, and the fact that Black females, we only make up 2% of the physician population.
You're not stealing the whole operation.
We're not. And again, if we're going back to Dr. Murphy, because I will not stop on this point, in 2018, of the 11,000 urologists, of which that is his profession, only 262 were Black. So this is a distraction on a scale that is unnecessary, because we're not taking anyone's spot. But if we are going to talk about the presence and the influence of what Black people can do, there was a study that looked at said that if you have a 10% increase in Black physicians, you increase life expectancy by at least a month. Life expectancy. just from our presence. And we have to understand, why does that happen? Now, what the Republican Party needs to do, instead of passing these bills, looking into try to interrogate Black people yet again for another generation, right? They need to say DEI stands for don't entertain insurrectionists. Start there. Because what we see with the presence and the diversity of groups across the spectrum is that we improve outcomes in transportation, housing, you name it, all the social determinants of health, which again improves outcomes across the board for all races. It's not just our people get better,
right?
Everyone gets.
Right.
And then I think another point that we have to make in looking at the obstacles you have to overcome. Me, for instance, I completed 3 degrees in 4 years while working 2 jobs and graduated with honors. And despite that, right, despite doing that, you're constantly having to prove yourself over and over. And as the mayor of the city said, he's duly elected incumbent. That's what DEI stands for him. For me, it's diagnosing everyone's illness. That's what it stands for me. But what does that do when you're constantly having to prove yourself as worthy, when you can go into a room with people like Elon Musk and say, I earned everything I have, but you were given it. And despite that, I will still allow you to have your platform and do whatever you want to do. But when you try to impede progress, you harm the very foundation of our country, because we're trying to make this the best. And if you're looking at the progress of what Black people have done over the generations, we literally have defined what this country means in terms of citizenships and writing and restructuring of the Constitution, in terms of public school systems and what we can do with Brown versus Board of Education. We can look at Medicaid and Medicare and the fact that the AMA did not want to support that, but the NMA did, because that would allow Black people to enter into hospitals and get treatment. And that's why we have those platforms. We can go on and on about how Black people just trying to be accepted as humans in this country has helped to shape democracy, and America is better for that.
Thank you to both of you. Thank you for the work that you've done in your careers, and for us and our viewers, and for this amazing conversation today. Dr. Ebony Hilton is a critical care physician and an anesthesiologist. Dr. Uche Blackstock is an emergency physician and author of the book Legacy: A Black Physician Reckons with Racism in Medicine. Hey, everyone, MSNBC.
Right. Lily Bell?
Okay, well, I think, excuse me, by now, that people realize with this DEI and stuff that all that stuff they were saying, they were just blowing smoke. I think more and more also become to realize that now.
Right.
So, but I just want to make sure I point that out. None of these programs, even the Medicare, Medicaid, and all that. Well, let me give you a backstory. I've worked in the medical industry and stuff, and I've always had access to everybody's records. Family history, medical history, blah, blah, blah. And the majority of the people that I saw that was on Medicaid were white people. The majority of the people I saw that was on Medicare were white people. And just as an aside, this brother was on this podcast. He was talking about when he was working in this grocery store. He said the most people he saw using food stamps were actually white people. So with the advent of the internet and different access to different things, I think we've come to realize now that a lot of this stuff they're saying is not true. But I just want to mention that. Don't ever make nobody feel like you're not capable. You are more than capable, because if you were not more than capable, you wouldn't be in a job that they're only capable of doing. So I just want to point that out. And you want to say anything before I keep going? Because you know me once I get started. So
I agree with what you just said, because statistically, there's not enough Black people in America to be more of us on welfare, Medicaid. So the facts are totally distorted, and it's lies after lies after lies. So you nailed it. So go ahead.
yeah, and see, and this is the interesting thing, and about with the DEI and different things, people fighting they want to get rid of this, they want to get rid of that, and now they are hurting. As a matter of fact, the Asian population, you remember when they went and started talking about I have a dream too. They want you to stop this DEI, but they wasn't calling it DEI at the time, but quotas and all this kind of stuff. And they fought for that and they got it passed, and all of a sudden they couldn't get into college. You
That's
see what I'm
right.
saying? So I just want y'all to understand. Don't let nobody sell you a bill of goods, young people. You're just as good as anybody else. As a matter of fact, you have to be better than anybody else. And with that, I get back to what these ladies were saying, these doctors were saying. I anyway, I don't know. I got so many thoughts. Go ahead, Louise. I got so many things trying to rush
I,
out
I
right now.
love the fact that the doctor pointed out, I think it was Dr. Hilton who pointed out how she worked while in medical school.
Mm-hmm.
She graduated with honors. Most Black people have not gotten anywhere through affirmative action or DEI. That has not, and that's the lie that's been perpetuated. And we need to make sure that that is corrected. It's nothing but lies, lies, lies. We're at the bottom when it comes to DEI benefits as well as affirmative action. So it going away has not impacted us the most. And even
No.
a lot of the stuff that Trump is doing is not impacting us the most. Who do you see crying and whining on YouTube, Instagram, all of these social medias about what's going on? Because they didn't expect what they're getting from Trump. Those who voted for Trump. I didn't vote for Trump, but those who did. Some of the stuff, I'm not saying everything he's doing is bad, because some of it is really showing people that he's not who they thought he was, especially the MAGA people. So with that said, let's pay attention, because Black people, we're brilliant. We have brilliant minds. And I'll give you another example about myself in the jobs that I've had. And I have had white people to steal my ideas and pass them on as their own. However, I found out about it. And I have, I was almost, I almost didn't get a job that I deserved because I passed the test. Because this was in the county of Los Angeles, who's supposed to be uh, the, what is it when you say you are for all of the different ethnic groups and so forth, you're not discriminating against anybody and so forth. In LA County, this happened to me. I had passed a test. This administration was interviewing a white man that didn't pass the test, and I found out about it. He was going to get a job, a department head job, that I was number one on the list, decentralized list. I don't remember where I was on the centralized. And I found out about it. And I went because I wanted to speak up and speak out. And I asked, why am I not getting an interview? I didn't even know you were interviewing. What they were going to do, and this is how they do it. They will put a white person in that position, and they will not do a written test. They will do a rating of record and allow that person to have the position if you don't find out about it. And they try and keep secrets on this stuff. So, and this was in California. So don't let anybody tell you that this stuff just happens in the South. It happens everywhere. And I questioned it, went to them, told them, and gave them a piece of my mind. And guess who got the position? I did. This white man had the audacity to come up in my face, and I was very young then, only about 27, 28, shook his finger in my face and told me he should have got the job. That's white privilege, you know. And I just let him know, why do you think you should have gotten the job over me? I passed the test and you didn't. So don't let these folks fool you when it comes to these jobs. And that's why I stress, become an entrepreneur. Use your talents, your skills that God has given you to have your own company so that you don't have to deal with a bunch of the racism. So go ahead.
Yeah, and consider when you want to go into medical college or any college for that matter, consider going to an HBCU. It seems like we give all these props to these non-HBCU colleges and stuff. We think somehow we get into them, we've arrived. But you have excuse me, Mahara. I'm sorry, I got my one up and these allergies are getting me. I apologize. Mahara College there in Tennessee. I forgot, I think about 7% of all the doctors at one time, Black doctors, came from Mahara College. So we have all these Black institutions and stuff that we could be going to where you accepted in there, you're not treated like second class citizens. But for some reason, because of European hypnosis, we would rather go and be mistreated and everything just to say we got into a non-Black college. So let's get back to, I was trying to think of a word. I don't want to say use common sense because, sometimes what's common is not really sensible. But start thinking in terms, let me put it this way. Start thinking in these terms. I'm not going to go and fight to be what I'm not wanted. But I can go without fighting to some place I can be well received. And one other thing do you want to say anything before I make the next point?
Just, you're right about me, Harry. I went to the graduation of a young Black doctor who is doing very well, graduated with honors, very smart from day one, knew that she wanted to be a doctor when she was like 4 or 5 years of age. And that's what she's doing. She graduated. I went to the graduation in Tennessee. This was about, I guess, 5, 6 years ago. She's doing very well. And I happened to meet another doctor who has her own practice in, I think it's Alabama. I'm not sure, but I think it is. Very smart women. So don't allow these people to try and put that on you that you need DEI or affirmative action to get into these colleges for your chosen field that you want to go into, because that's not the case. The Black people are intelligent, and we just have to do our own research and our own due diligence.
And I want to say this too, when the guy mentioned something about, he didn't call it race relations. That's what it boils down to. Young people, you cannot legislate feelings and emotions. I don't care how many laws that are passed. If a person is a racist, there's no law that can be passed to make that person non-racist. No, and laws are good. No, don't get me wrong. But so many times, well, they need to pass a law, but no. Laws don't change feelings. If it did, a lot of the stuff that you see happening to us now wouldn't be happening to us. So I just wanted to make sure we point that out, because for a long time when I was much younger, I got caught up in that. Well, they're going to pass a law. And then I realized it doesn't matter. Just be diligent. Keep your head on a swivel. Be aware of your surroundings and think of yourself more than just a person who wants to go where I'm not wanted, because that's where I'm validated at. I yield.
Absolutely. And you don't have to have anybody to validate you. My philosophy with myself, my own perspective, when I was born, I was validated as a human being. And I know they mentioned something in the video, I can't recall where, it had to do with something to the effect related to the Constitution and us being treated as human beings. These people don't treat us as human beings because they founded this country on us not being a whole human being. So that's why it's so important for us to be our best advocate, particularly when it comes to your health. Be your own best advocate. Take someone with you if necessary that has some type of information about the healthcare system, including the mental health part of it, component of it. It's vital, because look at the lives that were mentioned, that were lost, that could have been saved. And this young lady, beautiful young lady, thriving in social media, and because she was misdiagnosed and said she had fibroids, she lost her life when she had cervical cancer that could have possibly saved her life. The same with the person I chose to tell you about, misdiagnosed with gas and had blood clots. And that's something you have to pay close attention to, particularly when you have surgery And my son just lost his, just to share this quickly with you, because I want you to really be conscientious about your own health. He lost his leg due to people not paying attention to what was going on with him. And this just happened December of 2024. And he ended up with blood clots. And I told the doctor, because I knew what had happened to this young lady that I knew personally. And I told them, be sure and watch out for blood clots on him. And sure enough, he developed blood clots after this surgery of amputation of his leg due to a bad infection. One doctor even said he didn't even have an infection.
Mm.
And the other doctor had already said it. And this healthcare system is messed up, I'm telling you. So pay attention to your health. Watch out for the warning signs within your body. And if one doctor tells you something, by all means, if something doesn't feel right, get a second opinion, a third opinion, whatever is necessary. And I'm telling you from my own personal experiences, because of my own journey within the healthcare system. And thank God to this date, I'm not on any medications. I have been ill before. However, I paid attention. And the same with my son, over 25 years of dealing with his health care, being diagnosed with a rare bone cancer at 14. Now he's 44. He just turned 44. So, but without my due diligence, asking questions, making sure he got the best health care possible, he may not be here now. So that's why it's so vital. And that's why I wanted to do this video, to make sure, particularly us as Black women, pay attention to your health. Ask questions, write your questions down, take an advocate with you if necessary, and do your own due diligence. So go ahead, Lily Bell, and we're about to close now, but I thought this was so important for us to do this video, because I know you have a lot of wisdom, a lot of understanding. You do a lot of research as well, like I do. And I'm glad to have you to the show. Thank you for coming, and we're going to wrap it up. And I always tell everybody, I repeat, 2 Timothy 1:7, for God has not given us the spirit of fear, but of power, love, and a sound mind. Let's exercise it and make sure we take care of our health. Lily,
Yeah, and I want to mention about this young lady named Kira Johnson. Now, Kira Johnson was Judge Hatcher's daughter-in-law. Kira Johnson went into the hospital.
whose daughter-in-law was she?
Judge Hatcher. The Judge
Oh,
Hatcher.
okay.
Yeah.
Oh,
So
that
she,
was the TV judge, Judge Hatchett?
uh-huh.
Oh,
Yeah.
okay.
So she went in the hospital. She had a C-section. And within 12 hours of having a C-section, she had bled to death. And according to Judge Hatchett, she when the girl started having complications and stuff, they was questioning the doctor about, what was going on. And, they said the same thing like they pretty much said to the Miss Pat Way. No disrespect. It wasn't the name the lady at the beginning, Pat Way.
Jessica?
Yeah. But to her, this just this was expected to happen or what. And she said the girl was in so much pain and she was telling them, but oh no, that's just common. That's just normal. So, but it wasn't common, and she was bleeding to death. And she was right there in the hospital. So we have to, as you're saying, and as those two doctors are saying, we have to become more diligent about our health. Just because they wear those white coats don't necessarily mean this. And I say this is my last comment, I imagine. That's this doctor named Dr. Sims. I call him Butcher Boy Sims. He butchered Black women. And when they would have babies or whatever, they would go to him and stuff. He would deliberately just puncture their uterus and the womb, and if they got infection, he wouldn't treat the infections and everything. And he is called a father of gynecology, people. All these atrocities and stuff that these people do, and they get lauded up to all these titles and stuff. They have a statue of him. But a few years back, those people, when they found out about him and stuff, they made him take that statue down. But the point I'm making is, here you have somebody who is well known that he was a butcher, but he was elevated to a high status. It's almost like they get rewarded, like the cops. It's almost like they get rewarded if they do us harm. I yield.
And you're right. That's why this was entitled Do No Harm, because when you take that Hippocratic oath, that's why you're taking it, do no harm. And we have to be very careful because we know that there are people out here, they do not like us. They don't even want us on the planet. So that's why it's so important to be your best advocate. Do your due diligence. I cannot say that enough when it comes to your health, particularly us as Black men, women, and children. Take care of your children too. And just make sure that if necessary, you get a second, third opinion because you know your body, and always stay in touch with your body because that's so vital, because you can easily be misdiagnosed as a Black person going into these hospitals. I know a person that uh, did a study on Black care for her PhD or master's, one of the, I think it was PhD, doctorate degree. And that was one of the things she brought out about how Black people are treated in the medical industry. And I'm glad these doctors on this show, Dr. Hilton and Dr. Blackstone, I believe that was her name, they brought those messages out as well in the conversation. So let's pay attention to our health, ladies and gentlemen, and your children's health as well. And let's do our best to take care of us because there are a lot of precautions that we can take ourselves on the food we put in our body. That's so vital because we know the food, much of this food is not healthy, and it's all by design. So keep that in mind. It's by design to keep you sick. And just think, like I said earlier, I'm 74, not on any medications. Just think if all Black people or all Americans would like that. Where would Big Pharma be?
Amen.
Where would they be? And that's something I want you to think about. And again, I'm Louise Hicks. This is Aim to Purpose Spiritual Empowerment Hour. My special guest today, Lily Bell from Beneath the Crust. And I really thank you, Lily Bell, for coming in, shedding some light on healthcare. And I thought this video was worth sharing from the journalist Fauci. I believe that's his name. And we just need to take care of ourselves because nobody cares about you. So you have to care about yourself and love your fellow man or fellow woman, which when I said fellow man, it wasn't gender specific. So any final thoughts, Lily Bell, and we will close.
Well, I just wanted to invite them to stay tuned because what Louise and I are doing is we're revitalizing or reviving, whichever word, but anyway, we're bringing it back. I know I can get that part right. Our women's group, but we're working together to help each other. So stay on the lookout for that because it does take a village, and even in the Bible, and I'm not trying to push religion because my thing is whether you believe the Bible is the word of God or not, I don't think anybody can deny that the Bible is a good psychological book. But it says that one can put to flight 1,000, but two can put to flight 10,000. You think about that now. Just because you added one person with you, you went from being able to handle 1,000 to handling 10,000. So we got to buddy up.
You said from 1,000 to 10,000?
Yeah, one can.
That's right.
Yeah, one can put 1,000 to flight. Two can put 10,000 to flight. So just by adding one more to you, you went from 1,000, and my mind can't think that fast to give you a percentage of increase, but it's a big increase. We know that, but you see what I'm saying? So stay tuned, ladies. We're going to be telling you more about the group and stuff. We want to be able to come and empower each other.
Absolutely. Absolutely. And I'm looking forward to being a part of that group because it's all about empowerment. It's all about economic growth. And that's what we should be all about. And that's why I started my podcast, because I saw where uh, there was so much nonsense out here, food talk, that's
Mhm.
not elevating us as a Black community. And we need more
Yeah.
sensible content to elevate us to a higher level of consciousness. And that's why I started my podcast, Aim to Purpose Spiritual Empowerment Hour, because I want us to be empowered to grow, have legacy, generational wealth, teach our children, educate our children how to become an entrepreneur, how to pass it on generation to generation, because that is so important. That's how we become empowered. That's how we have resources that Dr. Martin Luther King had talked about. And I did a video about that. So look at my podcast and find that video, and you will see what I'm talking about, because we have to learn how to utilize our resources to our benefit. That's what's so important. And we need to make ourselves number one in our community and
Yeah.
thrive together, unify. That's so important. And thank you all for watching. Please share this video because it's so vital. Share, share, share. Thumbs up, give it a like, leave your comments. Go and visit Lily Bell's podcast, Beneath the Crust, because she has a lot of great content as well. And we're going to be doing another video that we're going to talk about what's been going on. All of this talk about Black fatigue. Is that what we're going to do it on, Lily Bell? Or was it something else?
Oh, I don't know. Whatever we do it on and stuff, come back.
Well, I'm going to
And
do one
always keep
about,
this in mind. Keep this in
I'm going
mind.
to do one.
Keep this in
Well,
mind. You can never empower yourself until you take responsibility for yourself.
that's right. That's how you empower yourself. You got to take responsibility. And I'm going to be doing one about this Black fatigue. So stay tuned, because it's so much going on now about Black fatigue. And uh, some Karen is trying to flip the script, and I'm going to go and give you some insight on that. That I will be doing along with some other videos that I'm going to be doing. And I had kind of been away for a little bit dealing with some personal things that I needed to deal with. So anyhow, thanks again, Lily Bell. I appreciate
Thank
it.
you.
And everyone, thank you for chiming in. Please again, share, 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 thumbs up, give it a like, leave your comments. And I always welcome more subscribers. The more subscribers, the more information that's passed on, the more we can elevate ourselves to a higher level of
Yes.
consciousness. So please subscribe, 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 share, share, share. Can't say that enough, because we want to build this channel up. We want to build Lily Bell's channel up. That's important. And again, I'm Louise Hicks, and I always leave you with this message. Your power lies within you. Let it loose, because your destiny is your command. God bless and much love. See you in the
And
next video.
be encouraged.
Be encouraged, definitely. And not only be encouraged, have courage.
Come on now. Come on now.
Bye, everyone.
Bye.